The following is a paid commercial program paid for by Deborah's Heart and Care Agency. The opinions and views expressed in this program belong to its sponsors and are not those of this station, their affiliates, or their employees.
Welcome back to the show. Joining us now, Shanika Smith, and we also have Jackie Woods of Deborah's Heart and Care Agency. Thank you, ladies, for joining us today.
Thank you for having us.
We're talking about the services that Deborah's offers specifically for Alzheimer's dementia patients. I want to begin with, if you have someone at home who may be suffering from this, at what point should you seek outside care?
I would say immediately. There's so many different support groups out there that can help, but you can also call our agency. We're open 24 hours a day, and a nurse will return your call.
And there are so many things that are involved in caring for an Alzheimer's patient. What types of services does Deborah's offer?
We offer non-medical home care services where we send a client or we send a caregiver in to assist with activities of daily living. Those services include companionship, housekeeping, meal preparation, and something as simple as medication reminders.
And then does Deborah's, what do they do to make sure that memory care for patients, that the patients feel more comfortable while receiving this care?
We incorporate care plans. We work with the clients and the families, and we sit down with them to not only see what their needs are, but also to see what their likes and dislikes is. This helps with making that environment more comfortable for them.
And Jackie, what needs are you specifically addressing in your care?
Education, for sure. A lot of people use the word dementia and Alzheimer's interchangeably, but they're not the same. Alzheimer's is the most common form of dementia, but dementia is just an umbrella term for different diseases that affects the brain in different ways. And so Alzheimer's, of course, like I said, is the most common form, and it affects probably about 50 to 60% of people as a whole. And so how can you identify Alzheimer's? It usually starts with memory care first, memory loss. So, yeah, so we do a lot of education.
Any advice for a family member who may have someone at home who is going through this? Anything that you can tell them to make this road easier for them?
Yes, I think my partner alluded to it earlier. Support is so important. Arkansas Alzheimer's Association, they are excellent. Of course, we love Alzheimer's. We love taking care of our families, educating, because it is a new normal. It's an absolute new normal, and we would love to help with that transition with the newness of it. So we hold your hand 100%, but also just getting support groups and being able to take time for yourself. That is super important to get away, and so yeah, we just hold your hand throughout the process.
And you guys are statewide, and you offer services 24/7. Is that correct?
Yes.
How do you contact Deborah's if you are in the situation where you may need some outside care?
You can contact us through our office number, or you can reach us through an email. Our email is
dhcagency@yahoo.com.
Okay.
Yes. Or you can Google us, simply Google us.
Yes.
Deborah's Heart, Deborah's.
Lots of ways to find you guys.
Yes.
We were talking earlier also about the effects of COVID on this industry as a whole, and more people are opting to have their loved ones at home and need your services more than ever right now.
Mm-hmm.
Yes.
Definitely.
How has that grown, and what have you seen in the last year?
Well, a lot of families have loved ones in memory care facilities or assisted livings, and in the past they have not been able to contact them physically, not been able to see them, and that has really taken a toll on a lot of families. So some have opted to pull them out of an assisted living, and if they call us, we accept all COVID clients, regardless if they have Alzheimer's or not, and we're prepared for that. But it's a hard decision. So however we can try to make their decision a whole lot easier by being their support and offering assistance in the home as well, then that's what we aim to do.
All right. A lot of times it's even easier for the patient than the caregiver, and so you guys are there to make life easier for both.
Yes.
Well, thank you, ladies, for joining us today. And if you need outside care, definitely call Deborah's. Thanks for joining us.
A lot of families have loved ones in memory care facilities or assisted livings, and in the past they have not been able to contact them, and that has really taken a toll on a lot of families. So some have opted to pull them out of an assisted living, and if they call us, we accept all COVID clients, regardless if they have Alzheimer's or not, and we're prepared for that. So however we can try to make their decision a whole lot easier by being their support and offering assistance in the home.